Welcome back to the Caribou Data Science channel. It's time for my weekly update to my COVID-19 model. Before we get to my model, let's just check the current state of COVID-19 cases and deaths in the U.S. So as of here's our current spike. You can see we did in fact have a spike back up here. But even with that spike, and this spike was enough, as we see, to actually give us the first weekly increase in cases in almost 7 weeks. But even so, the trend is still down. Okay, this is still below the peak up here. It's even still below this peak right there, the lowest peak. Okay, so that's cases. Now, if we look at cases by month, or by week, I'm sorry, you can see we had 1, 2, 3, 4, 5, 6, 7 straight weeks, 42 straight days of weekly declines. But last week, the last week meaning the week that ended today, the 19th, showed its increase. So we saw an increase in cases for the first time in 7 weeks. But we can hope and sincerely pray that this is simply a 1 week spike and not a reversal of the trend. So now let's move on to deaths. Okay, again, this is a death beginning with the April spike. Remember, this was the first spike back in April, which we're all panicked over. And yet, and then you can see the steady decline, began to climb back up here. But for these last few weeks here, it has been trending downward. Okay? But even so, there was enough of an uptick here to produce an increase to the first 1, 2, 1, 2, 3, 4, 5, 6. So this is the first weekly increase in deaths in 6 weeks. And again, we can hope and pray that God will have mercy and He'll take this, and this will only be a 1 week spike and not a trend. Okay, so that takes care of the summary for the U.S. for today. Now let's come back to first of all, let's go back and see what prompted this model for me. Here's an article. This is NPR. This is NPR for August 6, 2020. By December 1st, the U.S. death toll from COVID-19 could reach nearly 300,000. That's the grim new projection from researchers at University of Washington's Institute for Health, Metrics, and Evaluation, one of the most prominent teams modeling the pandemic. Well, okay, well, I guess that's fair. I mean, we can certainly have 300,000 by December 1st. But then there's this article from September the 4th, a little over a month later. Coronavirus updates. Trump asked everyone to be careful over Labor Day. 410,000 U.S. deaths predicted by January. Wait a second. Well, gee, I don't know who but look at this. Under some significant developments, the Institute of Health Metrics and Evaluation at the University of Washington School of Medicine is predicting more than 410,000 deaths by January if the mass usage stays at this current rate. Now, wait a second. Are they saying we're going to have 100,000 deaths in December? Because one model says 300,000 by December 1st, and now, a little over a month later, they're saying 410,000 by January something. So the purpose of my model, first of all, disclaimer, of course. You always got to have disclaimers. And that is, I'm an amateur data scientist. I have no formal training in either data science, statistics, or any medical field. But the model I'm using is maybe the most simplistic model that you can actually use, and that's a model that's based on daily averages, on the average number of deaths per day. Okay? So the question we're going to answer is, how many cases do we have to average, how many deaths do we have to average per day between now and December 1st in order to reach the 300,000? How many deaths do we have to average per day in order to reach 410,000 deaths by January 1st? Or how many deaths do we have to average per day to reach 410,000 by January 31st? And that's basically what this model is based on. So let's just come over here now, load some data. Load my libraries, load some data. And then the first thing we're going to do a couple of plots for the cumulative totals, or for for cumulative deaths and cases. So here's a cumulative total of cases. And first of all, notice the continued. This is what this is. You can tell this is cumulative because of the shape of the curve. It never goes down. So as of September the 18th, we've had 6.73 million deaths or cases in the U.S. so far. That's from the first case reported back on January 24th. Now, even though here, okay, remember what the talk back in April about flattening the curve? Okay, but anyway, these are cumulative deaths. The total number of deaths as of January 18th is 199 million. So the question is this: in order to get from 199,570,000 to 300,000 by December 1st, how many deaths do we have to average a day? In order to reach that number, 300 million or 300,000 by January 1st, how many deaths do we have to average a day? And so forth. Pretty simple math, actually. Create some more data. Now let's just run this. We are currently averaging in the U.S. 973.74 deaths per day. Now, so in order to reach 300,000 by December 1st, how many do we have to average? Again, the math is very simple. We take the goal, which is 300,000, subtract the current number of deaths, and divide by the days remaining to reach December 1st, 2020. Well, 973 is certainly less than 1,389, but what about reaching that 410,000 by January 1st? Well, we have to average 2,032 deaths per day in order to reach that number at 410,000 by January 1st. In order to reach 410,000 by January 31st, we have to average 1,577 deaths per day. As you can see, all three of these numbers are above our current daily average. Now let's take a look at our plots. Here's the current days, all right? So we come down here and we do a plot, and as you can see, the daily average is the back line, which is 973. The December 1st line is this blue line, the next line moving up, and that's the 1389. The green line is the number we have to reach in order to have 410,000 by January 1st, and that's 2,033 deaths. And the fourth line, which is the red line, is the number we have to reach, which is 1,577 deaths per day in order to reach that 410,000 by January 31st. As you can see, all these lines are well above our current daily average. And look, even back here, as far back as here, we were below a couple of these averages. We're below it here. Well, we had a spike here Even then, only reached the blue line, which the blue line is this December 1st deadline, but the deaths are still below here. And every time we miss the mark on one of these deaths, it seems to me that we have to make it up someplace. Okay, to me, it's just that simple. We have to make it up someplace. Okay, so that is my model. It's an incredibly simplistic model, and I'm sure other professionals would scoff at the simplicity of the model because sometimes it is simple. Yeah, there's exponential growth. Yeah, there's this. Yeah, there's faith. Yeah, but you know what? An average is a very simple way. Averages are used all the time. For instance, in stock analysis, you use moving averages, but they're still averages. So why can't we use averages, even moving averages, um, to estimate to model COVID-19 viruses? Okay, but anyway, that's enough of that. So anyway, it still remains to be seen whose model is going to be more correct. Okay, I'll check back with you next week and give you an update on this model. Thanks for stopping by. If you haven't done so already, don't forget to click on the red subscribe button in the bottom right-hand corner of your screen for all the latest data. Thank you again so much for your time, and I hope this is this is also encouraging to you that finally a word of encouragement to you to everybody in the U.S. The fact that we're continually staying below those averages, we need to reach either 300,000 or 410,000, tells us that what we're doing, wearing masks, social distancing, self-isolation, is making a difference. Okay? So once again, thanks so much for stopping by. Any questions, comments, be sure to include it in the bottom below. Thanks and have a nice day. We'll see you next week.